Hello wonderful people, welcome to my channel. Today is Sunday, and as you know, on every Sunday what you have to do, right? Tune in to Doris upon Poku on YouTube, Facebook, Instagram, all social media platform, and relax for some tips on your health because you deserve to be healthy. All right, to bring our discussion on arterial hypertension to an end, I have some questions people sent which I would like for us to discuss or go through. The first question says, my mom is very mad at her doctor because she assigned her to take in antihypertensive drug for the first time, which my mother don't buy that idea. So it ended up that she didn't take the drugs. What should we do about it? Okay, I understand what mommy is going through right now. You know, no doctor will just assign you to antihypertensive drug, or let me calm down. No doctor will give you BP drug or medication without knowing that you are at the verge of having that disease or condition. So listen, before the doctor will assign you to any antihypertensive medication, that means the doctor has observed you, but you don't know. Whenever you go to the hospital, we log in by reading your blood pressure. So you are having history right from the first day you went to the hospital about your BP. The doctor will make sure he has read your whole history, how your BP was and how it is going, before they will assign you to such medications. Because if you are having normal BP and the doctor assign you to antihypertensive medication, that means the doctor wants to cause another condition. You go hypo, which also can cause death. So no doctor will just assign you to BP medication whilst you are not having such. So take note of it. I know what she's going through. Even sometimes when you give the medication to them, maybe they will be having 150, 90, but the moment you tell them that maybe there is increase in your blood pressure and we have to start managing it, it will even jump to 180 or 170 because they didn't hear good news. If you are a patient and let's say you are going through such condition or you are in this situation, I think you are very fortunate that your doctor was able to identify it fast so that we can start managing it for you, because there are people who aren't fortunate like you and they die because of such condition. So don't get traumatized, don't worry yourself, no fear, no panic, everything will be fine. We started with maybe one medication. Fortunate for you, that means if you go by the instructions and advice, at the end of the day you can even withdraw the medication because your BP will be normal to the extent that if we do not take off the medication, you will even go low. So start the medication, take it, and it will help you. And stop the worry, because if you can remember the primary type of hypertension, people who are always traumatized, who are going through pain, who stress themselves, are those who normally have that type of hypertension. The reason is, in your brain we have a department called sympathetic nervous system. What that department does is it controls all actions, emotions, and other things that you have no control on them. So if there is, like, you are going through trauma, you are in pain emotionally, or you are stressed up, that department will work hyper, like it will increase its activity. And when it increases its activities, that means it will release a hormones to come and help, like hormones to manage those actions. You can't control them for you. We call that hormones epinephrines or non-epinephrines, and that hormones is there for good, but it will get to a stage where the hormones will cause vasoconstriction, or it will narrow your vessels, your blood vessels. And when there is narrowing of your blood vessels, the normal blood or the quantity of blood which is being produced won't be decreased. It will be the same blood which will be passing through the narrowed blood vessel. And all these conditions will cause increments in your blood pressure. So if you do not stop worrying yourself, you will be still causing more harm than good. Let's go through the second question. The second question says, my daughter is just 20 years, but the doctor says she is suffering from high blood pressure. So how come this condition? Okay. So in terms of high blood pressure, it doesn't matter the age, but what matters is the type of hypertension your child is having. So it can be that your child is suffering from secondary type of hypertension due to her age, because in terms of primary hypertension, it's people who are from, let's say, 25 years onwards are those who normally have that primary type of hypertension. But for the secondary type, if we can remember how I defined it, is as a result of having another disease or suffering from another disease, like you have kidney disease or chronic kidney failure, or there is stenosis of your kidney arteries. It can all cause high blood pressure. Or you have endocrine diseases, you have maybe hyperthyroidism, and maybe a lot of conditions, Cone syndrome and others, all can cause increments in your blood pressure. Or let's say you have some risk, a lot of risk, like you are diabetic or you are obese, or a lot of condition, you smoke, you take in much alcohol, all can be as a result of you having high blood pressure. So even family history, I said all in the first video. So your child at 20 years from the secondary type of hypertension, anybody below 25 years can have hypertension if only the person is susceptible or is through such condition. Even children, those who are having congenital acquisition of aorta, they can also have high blood pressure. Like their aorta, we have a blood vessel, big one within our body, which pump blood to all the parts of the body. If it is narrowed, that one too, it can cause increments in your blood pressure. So I don't think the age matters, but the type of hypertension your child is having is what matters. So it's not something. Let's talk about prevention of hypertension. In terms of prevention of hypertension, as we all know, it's not easy to prevent primary type of hypertension, because first of all, you do not know the cause of that hypertension. But we will use this strategy. We will use population strategy, whereby we will all reduce our salt intake. It doesn't matter your history, whether your family are free from hypertension or not. It's necessary to reduce your salt intake, because from the first video I said it's much intake of salt can cause hypertension. So take notes. At least the whole day, if you take in, let's say in average 5 grams of salt per day, is enough. It shouldn't be more. And those who are having high risk, also what you can do is necessary to start tracking your blood pressure value. Even at home, you can get those instruments used to measure blood pressure, and you get your book and pen and you start logging in the morning and in the evening with dates. You just keep record of your blood pressure value. You have to do exercise, and people who smoke, you have to quit from smoking. Those who take in alcohol, reduce alcohol intake. Even if you can stop, that one will be super. And people who are always worried, behavioral changes. As normal human being, there can be some good days and there will also be bad days. So when it happened that way, don't let it take hold of you. You have to calm down and ask God to intervene, and everything will be fine. Don't base on conditions to buy some sicknesses or diseases for yourself. And the secondary one, because is as a result of other diseases or different disease that will cause your blood pressure to increase, it's not easy to notice. You need a doctor to help you out through some investigations, because before that disease, if it's, let's say, kidney, before that disease will result to high blood pressure, that means there is organic change of that organ or that condition. Later that it will result to high blood pressure. So there is the need of doctors' intervention and vivid investigations. Thanks for watching. Like, share, comment, and subscribe, and see you next week.